Registered Nurses Midwives Association called off their strike, a nationwide exercise, because they said they were unhappy with their conditions of service. They called that strike off on day 3, and Manuel Kranting has been monitoring the situation for us since they embarked on the action on Monday. He's back at the Greater Accra Regional Hospital the morning after the president of the Ghana Registered Nurses Association, as she addressed the media, indicated that they had called off that action. So Manuel is going to tell us the situation at the Greater Accra Regional Hospital this morning. Manuel joins us live. Manuel Kranting, tell us what you can see and do a bit of comparison, because you were there, I think, on day 2 of the strike.
Well, Mama V, I'm here again, yes, at the Greater Accra Regional Hospital, Ridge Hospital. And, you know, activities seem to be picking up here. I've been to quite a number of hospitals in the past 3 days, trying to monitor and gauge the mood there. In fact, as of yesterday, a number of the hospitals were beginning to feel the brunt. And in fact, their activities were being crippled by the absence of the nurses. You know that even non-nursing staff were rendered almost impotent and ineffective because of the absence of the nurses. You couldn't do any meaningful work without the vitals of the patients and so on being taken by the nurses. And so, well, yesterday I was at the Kaneshi Polyclinic. They were even thinking of downsizing the non-nursing staff which had been left behind by the nurses. But today at the Ridge Hospital, things seem to be picking up. Quite a different picture from what we saw about 2 days ago, where the patients seemed really stranded, left to their fate over here. Now, the traffic is building up, and it's not just building up, it's building up with commiserate activities from the nurses, the doctors. Everybody seems to be, as it were, synchronization. Everybody is doing their own bit in the long chain of services that are being doled out here at the Ridge Hospital. I'm going to try to get closer to a few of the patients who are here, and in your shot now you can see chairs that have been lined up with patients also queuing for their turn to go see the nurses and then also move to see the doctors. I'll try to get a bit closer to them. This is almost like the number we saw about 2 days ago when the nurses were on strike. And so that's generally the picture. They are here, and this isn't what we saw 2 days ago when they were almost frustrated and stranded. You're seeing them, some of them, beaming with smiles, because at least they are hopeful that the nurses being on duty are going to attend to them and then keep them, a bit away from their sicknesses. I'm going to try to speak to a few of them here. Madam, good morning. So I'm going to speak to this woman here. Madam, good morning.
Good morning.
Great. How long have you been here?
This morning around 5:30.
Great. What, you didn't know that the nurses were on strike? Or were you here in the past few days?
I was here last week, but we heard it in the news that they were on strike. But then yesterday we heard that they have come back to work.
So you decided not to come at all because you heard that they were on strike?
No, my scheduled time is today.
Okay.
Yeah, that's why I'm here.
And when you came, what has been the picture here?
It's quite, they are working.
Okay.
They are here and they are working.
Okay.
Yes.
So you're optimistic that they'll continue working. They say government, they're giving government 4 weeks to sort all their issues out. If they don't, they're going to put down their tools again. As a patient, you are not concerned?
We are all concerned about it, but some of us have some questions to ask. Is their demand or whatever they have had, has it been there from so long, or maybe when they were even coming to be employed, was it part of the agreement? If yes, why was it cancelled? And if no, if there are new things they want to do, I think they need time. They themselves and the government need time. Maybe they've been asking for maybe a year or two, but yes, so they will have to have patience, especially concerning our health, the health of the nation. So they should take those things into consideration and then probably see how far they can go with it. Yeah, that's
Great. So you are hearing one of the patients being quite reasonable with the situation, calling on government and even the nurses also to Georgia, and as it were, find middle grounds to continue the services going. They don't want it interrupted so that, you know, it affects the patients. And you could see some of the nurses over there already, you know, reporting to duty in here where their vitals are taken. And we'll try to get a bit closer to the gentleman who's been calling out the names and then also the numbers of the patients here. My boss, quite a different picture this morning away from 2 days ago. How's it going?
I better talk to the nurses in charge. They're in charge.
So the in charge is here.
Yeah.
We'll try to get a bit closer to them and then get you some pictures. But as we try to do that, let's speak to a few more of the patients, because, you know, they seem to be at the, you know, the heart of the feud, as it were, between government and then the nurses. Like they say, when two elephants fight, well, the grass is what suffers. And so they are the patients, and they are the ones that are expecting their services. We'll try to speak to a few of them. Madam, good morning.
Good morning.
Madam, how long have you been here?
Like, I've been here 4 months ago. Yeah.
Today?
Today I've been here about like 3 hours ago.
3 hours. So you're seeing the nurses, they are at post and they are working. How does it make you feel?
I heard that they went for strike, but they resumed this morning, so they are preparing to come attend to us. Yeah.
And when they were on strike, what were your feelings?
Well, I felt bad because without them, the patients, what are we going to do? So they have to take care of us. So we feel bad, but we thank God that they have come back. Yeah.
So you're hoping that they continue to be at post, correct?
Yes. They should be at post.
Great. So she's also telling me that they are happy, really, that the nurses have come back to post, because when they were away, they're feeling bad because they take care of them, in her own words. And I'll try to get closer to a few more of the people. I see them, you know, in pensive moods, you know, trying to listen attentively as the numbers are being called out in the background, as you can hear. But let me speak to this lady here. My lady, good morning. What's your name?
Rosemary.
Rosemary, what are you here for?
Oh, I come with my mom.
Okay, you came with your mom. Were you supposed to have come here earlier?
Yes, we come earlier at 4 p.m.
Okay.
If we're hoping for the rest, we're hoping for the nurses. Yeah.
Did you visit here any of the days while the nurses were on strike?
No.
Why?
Oh. We didn't go there. We were just coming. My mom just came. That is why I come here.
All right, so she's telling me that the nurses were on strike. A few more of the patients here this morning. Let me try to get a bit closer to this lady here who, you know, the nurses are on duty this morning. My lady, good morning. How does it make you feel as a patient who is coming to the hospital, knowing that they've been on strike for 3 days? Today they are on duty.
I'm so glad they are on duty, yes. This is my first time coming here.
You are glad they are on duty?
Yes.
Well, they make a point that the government is not, you know, really concerned about their own, you know, welfare and so on and so forth. That's why they lay down their tools. They've given an ultimatum of 4 weeks, after which, if their concerns are not met, they'll go back again. You are hopeful that things will be ended before then?
Yes, I hope so. I hope that the government sorts out things with them very as soon as possible, yes. So that we can. I hope the government sorts out things with them as soon as possible so that we can visit the clinic, the facility anytime we want to come here. Yes.
Okay, great. She hopes that the government will sort it out immediately so that they can visit the facility any time that they want. But I mean, you look at the numbers that have been given out, have been called out. What's the rate of movement? Do you think it's moving well?
Yes, I think it's moving well. Yes, because we learned they were on strike and we heard they've resumed. So the number of patients here is encouraging. We are hoping that from tomorrow next, everybody can come here. Yes.
Great. So that's generally the picture. In fact, the nurses who, speak to me off record tell me that they are not taking anything out of the services that they ordinarily render at the hospital. It is a full service that they are giving, at least for the next 4 weeks until government sorts out their issues. And so, anybody who visits the Rich Hospital would receive almost the same, in fact, the same services that they've been receiving prior to the strike that we saw last Monday. And so generally the picture is almost calm, and things are returning to normal here at the Rich Hospital. The patients seem a bit satisfied that at least the nurses are back to post and are attending to them. That also means that the doctors who were taking extra roles earlier in the week will now have to return to their normal routines, which will take the pressure away from them also. So generally things falling back in place at the Rich Hospital, and that's really the picture over here. Mama V, if you can hear me,
I can
over
hear
to
you. I can hear you. Manuel Cranting, our roving man, really appreciate it. Thanks for this conversation and telling us what the story is at the Rich Hospital. Appropriately so, because Manuel was there just 2 days ago when the nurses were on strike. Let's cross over from Accra. Let's go to Techiman, to my colleague Anas Sabit, who is at the Holy Family Hospital. Anas, good morning, if you can hear me. Tell us what's happening at the Holy Family Hospital after the strike was called off.
We are here at the Holy Family Hospital. This is the largest hospital in the Bono East region. It serves as a referral center for most of the areas in the region. And as at now, I can see only a few of the nurses on the ground. We have also a few patients coming in. I think the information has not gotten down well with the people, and that the nurses resuming their duties this morning. So we see, unlike before the strike, a lot of people have been in the queue this morning. But unfortunately, when we go to we spotted only a few people here. But I spoke with some of the nurses off camera, and they say today they are resuming their work in full. And so all kinds of treatment will be given to the patients who are on the ground. But the fact is, only a few of the nurses
I am afraid we have to let Anas Sabit go because he's not quite audible. There's an issue with that audio that we have to work on it and return to him. The Holy Family Hospital in Techiman. But let's cross over and go to Rafiq Salam, who is in the Upper West Regional Hospital, to give us a situational report. Rafiq, a very good morning to you. The nurses and midwives resumed work today, 24th of September. Explain what's happening at the Upper West Regional Hospital to us this morning.
I can tell you, Mama B, there are early hours yet at the Upper West Regional Hospital, and I can report to you that a dozen of patients are right here, but the nurses and then also the midwives are not currently at the OPD. I'm told that OPD services in this hospital starts around 8 o'clock. And so I've seen a dozen of patients are trooping into the hospital, and they are yet to be attended to. I spoke to the few nurses and midwives around, and they told me that today they are going to resume full services at their facility. Remember, this is the last referral facility in the Upper West region, and so majority of the people or patients depends on the hospital. And then also, if we also even look at it as the previous days, the facility, they were not attending to patients, and so private health care here was very important. So some of the private health facilities were cashing in on the patients. So I can report to you that everything at the Upper West Regional Hospital is moving on smoothly, and then the patients are already there. But encouraging is about the ENT clinic, ear, nose, and throat. They were operated last week, and they were asked to come for review today, and so they are patiently waiting with bated breath for the nurses to come to attend to them.
Quickly, Rafiq, let's talk about the impacts that this 3-day-old strike had on the people of the Upper West region. What are some of the stories that you can share with us?
I can tell you that the facilities at the private health care was very important, like as I reported to you earlier, because most of the few private health care facilities in the Upper West region were inundated with patients, because these hospitals, talking about the Wa Regional Hospital and then also the Wa Municipal Hospital, the patients were not being attended to, so they have to resort to other means of what? Of taking care of themselves, or seeking medical care. And so you have few medical private facilities, they were cashing in on that. And then also other methods or orthodox methods were used to at least to take care of them. So the impact here was very great. We didn't record any death, I can tell you here, but it was great. And then the patients were really suffering.
Well, Rafiq, we thank you very much for that update. Rafiq Salam reporting from the Upper West Regional Hospital. So from Upper West, we move to the Ashanti Regional Capital, Kumasi. Nanaya Ojima is reporting from the biggest facility, Komfo Anokye Teaching Hospital. Nanaya, what's the picture this morning?
At the Komfo Anokye Hospital, there are a number of patients who are now walking in to get the medical attention that they deserve today. So it's yet to hit 8 a.m. The official time, we know that the nurses on morning duty will be reporting, but there are a number of people here to seek healthcare delivery at the OPD section of the hospital. So if you can see behind me, due to COVID-19 and its protocols, they are limiting the number of people who get access to the main OPD section. So a tent has been made for them here, and a number of them are here behind me, and they are waiting for the nurses to arrive. I have with me one gentleman who was scheduled to be at the hospital today and get the necessary healthcare delivery that he deserves. I will be interacting with him and get to know how he feels about what's happening here currently. Sir, good morning and welcome to join.
Good morning.
So I'm learning that you were scheduled to be here at the hospital for medical treatment today.
Yes. I was here last week, Friday, and I was given today to report. And when I came up to now, I was given 7 a.m. 7 a.m. I was here, and up to now, I'm not getting any attention.
But we are learning that at 8 a.m., then the nurses will be coming. And
yes, I know that the nurses report around 8. But up to now, no sign of anybody.
But have you been assured? Have you been given an assurance that today will be taken care of?
Well, there was a guy here who told us that we should wait patiently up to about 9. If up to about 9 and there's nobody, then maybe they might not work.
So, Mamavi, that is from one of the people who are here to seek medical attention. And already I've seen a number of nurses walk in. So at 8, we expect them to commence their normal duty and get treatment for all those here. So this is Komfo Anokye, and this is what's happening here. But I know that other health facilities like the South Centreso Government Hospital, they are also taking actions to commence work today. And at the South Centreso Hospital, before now, the wards were closed. Some services like maternity services were also on hold. But from the information that I'm gathering from the medical superintendent, today everything will resume because the nurses who are the main people who man these areas are all back.
All right, Nanaya Ojima, thank you very much for that update from the Komfo Anokye Teaching Hospital, the second largest hospital in Ghana, the biggest in the Ashanti region, serves quite a number of regions as well. It's a referral center, and to think that because of the action, what Nanaya Ojima is telling us this morning about the people and the expectations and the fact that the nurses have resumed, that wasn't the picture yesterday. So thanks to Nanaya Ojima from the Ashanti region. We go back to the Bono region, to Techiman Anas Sabits. Hopefully we can hear you clearer now. Anas, you are telling us about the situation at the Holy Family Hospital.
Yes, Mama V. I was saying that the Holy Family Hospital is the largest hospital in the Bono East region, and it serves as a referral center for most of the health institutions around. And this morning, as at now, we have the hospital in operation. We have some patients here are waiting for the nurses to resume their duties. I've seen a number of these nurses on the field or on the ground, but their number is quite not that much. The patients, like I said, today we will be expecting, or we should have been expecting, a number of them here. But I believe most of them are not aware the nurses will be returning today. But some of the nurses have told me off camera that today they are resuming their duties in full. And so all the patients who are here are going to be attended to after 8 a.m. So we are waiting for the time to for 8 a.m. and then we'll see what happens.
For the last 3 days since this, and as if you can hear me, help us appreciate how the strike impacted the lives of persons who usually patronize the Holy Family Hospital.
Yes, I was here on Monday and then on Tuesday, and of course all the patients who were here without knowing the nurses were on strike were actually have to go out and then attend to or get to the nearest private facility in town. But the situation is even much more terrible in rural areas, especially in the Techima North area, where we know there's no private hospitals, and so they were all relying on the health centers around and then the chiefs compounds around. So those areas, when I visited yesterday, some of the chiefs compounds were totally closed down, and there were the health centers. I met some finance officers, but there were no medical officers or nurses around to take care of these patients. So those areas were heavily affected, unlike Tichiman, where we know there are quite a number of private hospitals who were taking care of these patients in the absence of those that are here at the Holy Family Hospital.
And Asabet, well, thanks a lot. And just the tail end of his report, that update that he was giving with regards to how this impacted in rural areas, that's when you actually really feel the impact of this action and the importance of the nurses and midwives who went on this action. Reason a lot of people are calling for this to be resolved as quickly as possible. Let's go to the Western region. My colleague Natalia Kwansa is at the Kwesimintim Hospital. Ina, if you went to the Kwesimintim Hospital the past 3 days when this action was effective, tell us the difference. 3 days ago, yesterday, and this morning.
So, Mama V, on Monday, most of them were not aware of what was happening on Tuesday as well. So you could see people coming in here. But when you come here, you would see that it was left with only the doctors who were working, all the nurses were home. But this morning, I could count about 10 nurses working. As I'm speaking to you, some are still coming in, but the patients are all sitting waiting for them to be attended to. I have spoken to a few of them off record who says that, well, they've been asked to come, so they will do their best. And then this morning, they would attend to all their patients as they've been doing previously.
All right. Natalia Kwansa there reporting from the Kwesimintim Hospital. Ina, thanks a lot for that updates from the Western region. We'll try and get an update also from the Northern region with our colleague Martina Bugri when that report is ready. But we're jumping into another conversation, also health related. Now, babies born at frequent intervals are sometimes not fully developed. Disability rate also increases. Care becomes difficult and infant mortality increases in the mother's womb, they say. This week is dedicated to family planning, and so we will spend some time to discuss the freedom to decide how many children to have and when, the freedom to pursue healthy sexual lives without fear of unwanted pregnancies and sexually transmitted infections, including HIV. What am I saying? We're talking family planning up next here on our show. Stay with us.